Good morning, everyone. Thank you for joining us. We're very excited to share the hard work and partnership and collaboration of this group that really has prioritized addressing older adult isolation in Northeastern Pennsylvania. I am Dr. Mary Sawatsky. I am the newest member to this collaborative. I have just recently accepted the position as interim CEO at Moses Taylor Foundation. For those of you who don't know, Moses Taylor Foundation is really dedicated to improving the health of residents of Northeastern Pennsylvania. That's all inclusive, physical, mental health, dental health. We work very closely with our community on this and are so happy to have been part of this collaborative. The concept of addressing older adult isolation was one of our priorities at the foundation strategic plan that began in 2018. And this group has been vital to moving that forward. I want to thank everyone for joining us with that. But as the newest member, I really can't take any credit for all of the hard work that's been done. So I'm going to actually turn it over right now for a brief presentation by Christine Marcos. Christine is a senior program manager here at the Moses Taylor Foundation. She's been working with this from day one at the foundation and with this group, and I'm so happy to introduce Christine to you.
Thank you, Dr. Sawatsky. As Dr. Sawatsky mentioned, in 2018, recognizing the serious health impacts of isolation and prioritizing older adults as a key population to serve, the Foundation's board announced reducing older adult isolation as a strategic grant-making focus. And in fall of that year, we invited dozens of community stakeholders working with older adults, including many of you who are on the call today, to a planning retreat to help us set our priorities and plan to tackle this initiative based on the unique needs of our community. And the illustration that you're seeing on your screen right now was actually created by an artist who attended that planning retreat, and based on the conversations and discussions that she heard, illustrated the key points that the group had emphasized. And I'm so happy to say that we see a high degree of synergy between the points that are highlighted in this mural: collaboration, identification, reducing stigma, collective capacity, and the concrete plan that will be presented today. We were so inspired by the more than 30 organizations who, under the leadership of the United Way of Lackawanna and Wayne counties, responded to our RFP to design a system to reduce older adult isolation in Lackawanna County. And our collaborative worked through many challenges, especially COVID, but remained committed to a collaborative, community-based solution. So we really hope that this plan resonates with all of you as well, and we look forward to the opportunity to hear your feedback. Thank you.
Thank you, Christine. And so with no further ado, I'd like to introduce Gary Drapek, President and CEO of Lackawanna and Wayne County United Way. They have been obviously very instrumental in this collaborative, bringing it together, and so we welcome their comments. Gary.
Mary, thank you. And it's good to see you again. And I would like to really thank the board of the Moses Taylor Foundation for having the foresight to gather, to begin the group of individuals and organizations together to address this problem. And the problem that we have learned as we move forward on this is very much a problem that is being hidden under a basket. It's a serious problem in our community and throughout our country, but yet very little is known about it. Just a quick overview of how we got to this point today. I think it was in the summer of 2019 when Moses Taylor Foundation challenged the community with a grant, an RFP grant, to come up with a plan to address older adult isolation in our region. Once this plan was put out, the United Way was approached by a number of organizations in the community, and we were asked to take the lead role in completing the grant and moving the process forward. After we began this process, we received about 20 to 25 letters of support from organizations throughout our footprint and beyond, including a few statewide organizations. And we submitted the grant, and on December 5th, around the beginning of December, we were notified that of 2019. And again, the dates here are very key to the presentation today. December 5th, 2019, we received the grant and began the process. We held a kickoff event, which was incredibly successful at the Hilton Convention Center on February 26th, which was attended by a little over 100 individuals representing a host of organizations throughout the Lackawanna, Wayne County footprint. This was really the first introduction, I would say, to many of these individuals in these groups to the problem of older adult isolation. And it really was an eye-opener. And the enthusiasm that came out of that meeting was really very heartening to all of us. Again, thanks to the foundation, we were able to open the session with two very well-known and very knowledgeable presenters. The first was Sarah Horst from the Institute for Clinical Systems Improvement out of Bloomington, Minnesota. And Sarah presented a very good session on the value of collaboration and partnership, and the value of bringing groups together, leaving your political hats at the door or your egos at the door, to sit back and say, okay, here's a problem. How can we all work together and solve that problem? And the other presenter is an individual who's since become a vital component of our ongoing process over the past 2 years. And I have to say personally, has turned into a lifelong friend. It's Dr. Leonard Kay, who's the director of University of Maine Center on Aging, who presented a more global outlook on the problem of older adult isolation, what other communities are doing to address the problem of older adult isolation, and how we as a community can take a look at this situation and move forward. Following those sessions, there were breakout groups, and the three breakout groups broke into Aging Resource Network and Navigators, Isolation Tool, and Public Education and Awareness. And from those three breakout groups, we then established subcommittees of a collaborative, which would then move forward to address each one of those issues to come up with the final plan. And I'm just going to stop there for a second and strongly encourage everyone to take a look at the plan. What you're going to see today are very brief highlights in the little time that we have, but the plan really gets into great detail as to how we as a community can come together to help address this issue. So we were all set to go, everybody's moving forward. And then somewhere around March 14th, we were all introduced to our dining room table offices and some newfangled thing called Zoom, when everyone kind of had to, because of the pandemic, isolate ourselves. Shortly after that, we received a call from the foundation, actually, who very graciously offered to forego the grant because all of us, United Way and all of the agencies that were involved, were now in crisis mode. We were, doing food banks. We were delivering home delivered meals. We were knocking on seniors' doors to make sure they were okay. But the silver lining in the cloud, I guess you would say, of COVID was the fact that for the first time, all of us experienced isolation. Everyone who in the community, no matter what your age, experienced isolation. And this was the same situation that seniors and older adults are experiencing every day. So our collaborative, and Christina, if you could put up the next slide, our collaborative agreed that we weren't going to stop our work. We were going to continue on with our work as best as we possibly could with the time constraints that we had. We did put a postponement on it, and we then moved ahead to, I think it was somewhere around January of 21, when we brought the collaborative back together full strength and worked on the plan and agreed to have the plan completed by September 6th, 2021, and submitted by September 6th, which it was. I would like to take this opportunity to really thank our collaborative partners. What you're about to see, or what you see in the plan, is really the result of a lot of hard work by a lot of individuals and organizations within our community who stuck together, who came together as a collaborative and partnerships, And I have to say, if I can add one last thing, I have never seen in my work here at the United Way a group such as this that has stayed together with no real, if I say use the word ego for lack of a better term, but for one outcome, the outcome being to help address the problem of older adult isolation. So we couldn't have done this without the list of partners that you see before you today. I'd like to thank them for their work and for everything that they've done. So with that, what I'd like to do now is introduce our very good friend, Dr. Leonard Kaye. Again, he's the director of the University of Maine Center on Aging, and who has spent quite a bit of time with us on Zoom meetings and phone calls and helping us move forward. So Dr. Kaye, thank you.
Good morning, everybody, and thank you, Gary. I really appreciate your kind words. And I made note of the fact that you now call me a lifelong friend. I'm going to hold you to it. But the
You're welcome in Scranton anytime.
Thank you very much. I appreciate it. And normally I would be there at a meeting such as this. And in fact, I've been there a couple times prior to the pandemic. And that gave me a superb opportunity to be introduced to your collaborative, to the terrific work of Moses Taylor, of United Way, and that impressive list of partnering organizations in the community. That list is truly impressive. It would be difficult for me to come up with an equivalent list here in Maine of organizations that have come together with a common cause and a common charge and remain together, as you said, over time. So I just want to briefly, in just the few minutes that I have been allotted, talk to you about what I've seen from the outside, if you will, as a consultant. And for the past 2 years, I've done just that. And I've gotten to know, I think, pretty well the dynamics, the commitment, and very much the intimate details, if you will, of the project that is being undertaken and being proposed to the foundation. What struck me over the past 2 years, I have to say, is the fact that no one assumed that this plan would be written and documented overnight. A process was entailed. It required participation. It required everyone having a voice, and that participatory process was truly respected. Very clearly on, I think in large part, it was respected because everyone very much knew why they were there. Over the last 2 years, social isolation has become a personal issue. And over the years I've been a gerontologist, I have discovered that issues in the field of aging don't really become truly placed on the radar screen until people experience them personally. And social isolation has been the case of something that we now know is truly a public health epidemic, if you will, a hazard that needs to be addressed. You have that common charge. You've done something through your collaboration, which is special, and that is you've merged a variety of organizations across the health and human services and beyond. That is not an easy task. You have brought together to the table, in effect, strange bedfellows who don't always talk the same language, who don't always see their charge in the same fashion, and in large part don't see each other functioning as partners in carrying out the good work that everyone wants to perform. But you've done that. And you have clearly what I've discovered is the expertise to make this work. Next slide, please, Christine. So I just want to quickly summarize my observation of the 3 subcommittees that you'll probably hear more about. And certainly if you look at the plan, you'll learn of their good work. The screening tools subcommittee, in my view, very carefully, very systematically, very thoughtfully studied the possible tools and scales that might be used to screen for isolation. And eventually they emerged with the proper tools, ones that will do exactly what you want them to do. And that is identify folks at risk who then will be referred, hopefully, to navigators and needed services. You've mapped out the pathway. Terry, who you'll hear from, I think, shortly, and others have documented graphically what that pathway will look like. It's been done carefully, again, systematically. And so the process of an older adult getting help is laid out loudly and clearly. And then that subcommittee also did not forget that documenting what a program experiences is crucial for accountability reasons, and also to document success. And by the way, ways in which programs always can be improved. So data collection is part of your effort. Good for you. Next slide. The navigation subcommittee, I think, was equally successful in carrying out its charge. I've observed that they successfully have developed the qualifications and the role that the navigators will perform. They studied carefully whether volunteers could perform that role effectively, and ultimately determined they could with professional supervision. That, I think, was a very thoughtful and intelligent decision. It'll allow you to sustain the program into the future with minimal costs or manageable costs, if you will. You know that training and supervision of that navigator is crucial, and it's my understanding you're going to build in that training right from the get-go into the navigator's mindset and those who work with navigators, and that's a good thing. You know that also those navigators need to have immediate access to resources, and you will be able to do that because they will have access to databases that enable them to identify quickly, objectively, and accurately the resources available in northeastern Pennsylvania that they may critically need at that point in time. And then I think you've not forgotten the fact that the older adults who interact with these navigators are going to be involved in a crucial relationship. It may not be a lifelong relationship, but at that point in time, it'll be a meaningful one, because for many of them, that will be one of their few connections they have to the larger world. And so that relationship needs to be appreciated and respected. Next slide, please. And finally, the Public Awareness Subcommittee has done something that's near and dear to me. They've thought clearly about the marketing strategies that need to be undertaken. They recognize that you need champions to spread the word about a program like this. These are your spokespeople who are respected and trusted and can relate to the communities that they're speaking to. You recognize that words have meaning, and I think everything I've heard suggests that the marketing messages you're going to be sending will very thoughtfully and carefully select the words they want to use, so that you minimize the likelihood of anyone being embarrassed for seeking help or being referred to help, and not worrying more than they need to about the fact that they need to ask for help. I've learned here in Maine that the stiff upper lip mentality, the stoicism of folks residing in rural communities is really worrisome, because that can restrict them from asking for help. And so we need to break through that barrier. And then finally, I think you clearly understand, for this program to work, that you need to reach out to diverse audiences, not just older adults, but their caregivers, their friends, their neighbors, those who they interact with in local businesses, and so on and so forth. And so I have no doubt your public awareness campaign will do just that. It'll be a diverse one, reaching out to those who can help in various directions. Last slide, please. And then, so here are 7 bullets that I would ask that you remember. If you don't remember anything, these are the takeaways, as far as I'm concerned, that will most likely ensure the success of this initiative, should it be funded by the foundation. You're off to a great start. What's crucial is that coalition remains strong and stable and robust and genuine. What's crucial is that everyone in that coalition have a role to play. It should not just be symbolic. As much as possible, they should have tasks, responsibilities. They should have skin in the game. Number 3, every step along the way, older adults need to be respected and listened to. They need to have a voice. They need to feel empowered. Not every older adult will want an intervention offered to them, and that is their right. Lines of communication must remain open. You've made it clear that you value that highly. Meetings need to be held. Emails need to be sent. Documents need to be shared. The program needs to be fully transparent. The service itself, I've talked about this, needs to be non-stigmatizing and user-friendly. The process, the pathway through which people ask for help needs to be kept simple, needs to be kept easily, one that can be easily maneuvered. The public needs to hear about this program far and wide, or in fact, you'll fail. The best programs in the world fail because no one knows about them. And you don't want that ever to be the reason why this program doesn't succeed. So communications, marketing, messaging is crucial here, because everyone needs to buy into it. The community at large needs to feel responsibility for attacking what in fact has become a public health hazard, and that's social isolation and loneliness. It's an epidemic in our time. And the Northeastern Pennsylvania group, as far as I'm concerned, has the opportunity right here and now to set the standard for the nation. You're on the right track. Keep up the great work. Thank you.
Good morning. I'm taking on the next section of the presentation this morning, representing the Isolation Screening Tool Subcommittee. Our group focused on 4 separate tools that rose to the expectations of the collaborative. We studied them and evaluated them for validation by cohort, meaning that they were specifically validated for seniors. We wanted to ensure that the tools transcended gender, race, ethnicity, and income levels. We also looked for ease of use by the user, so the individual taking the assessment, to ensure that it could be done quickly, it was easy to understand and easy to use. And then finally, ease by the administrators, so who would ever not just be administering it to the senior, but also those who would be doing the scoring and interpretation. All of the tools except the USERS tools have been around for decades. The Duke Social Support Index has had several iterations, shortening it and modernizing it, but still the most current version is about 10 years old. Along the way, we encountered some challenges to overcome. We learned at one point that the state is going to be working with aging organizations across the state using the UCLA Loneliness Index. So we were able to incorporate a two-step process, and I don't want to get into too much of the navigation because Peg would be talking about it, that individuals who first come across a senior can implement the UCLA loneliness component first and meet their own guidelines within their specific agency, and then recommend that the individual contact the collaborative for services. Ultimately, we focused on the USERS tool. It is a newer tool. It is validated. It has been used by AARP, and it is currently being used with a smaller collaborative group in both California and Texas. So the next slide, please. The USERS tool was created by a professor, Dr. Matthew Smith, and he administers its use by organizations across the country. As I mentioned, AARP used it in nationwide studies and helped validate the tool. It is a 13-item question. The first 4 questions are just the qualifying questions. And if a person tests green on those 4 questions, they don't need to carry on to the remainder. But the items are 13, very easy to use. It can be done in 2 to 3 minutes. It is available in both English and Spanish, and we have the option of customizing it. So we can add questions that we have an interest in as a region. We can certainly add the demographic questions that we would want to track for the user and have that flexibility in administering that for a Northeastern Pennsylvania version. Next slide, please. Finally, the ease of use, and that's what we need to be concerned about. We want it to be easy for the senior, we want it to be easy for the navigator, and we want to be able to have quick, immediate results where we can track the senior's progression through the program. So the results are immediate. They're available for download into Excel. It's a personalized report, and it's color coded by questions. So green, yellow, red, based on a person's scoring for isolation. And based on the way this questionnaire was formulated, there are algorithms built into the question and the response that will also identify the types of resources that might best fit the senior. That makes it easier for the navigator because they then can look at the resources that are available in Northeastern Pennsylvania that deliver those types of programs and services and immediately connect the senior with those programs. Another factor, of course, was cost, and it is very cost effective for use on both a short and long-term basis. And now I'll turn it over to Peg, who could talk about the navigation or the seniors' progression through the collaborative.
Thanks, Terry. Well, as you've heard, like a lot of what the work has done, well, there's been specific subcommittees. There's like a synergy between the 3 of them. So the general, I mean, the concept was anybody in the community could be able to screen for an older adult. It could be your bank teller, it could be your pharmacist. And we would suggest they use that 3-question UCLA, that tool that Pennsylvania Council on Aging is promoting at this point. If they screen yes, then the referral could be made to the navigator where the more intensive screening would be done. And as Dr. K had said, we spent a lot of time saying how that was going to work. So we determined that they would be highly trained volunteers supported by a paid professional. Built into the plan, as Gary said, if we, the information on the training is in there, we would contract and utilize the trainer approach to keep the costs down, and then as volunteers transition in and out of the program, we would still have the basis of the training that we would need to be able to train the volunteers to meet with the older adult, or to reach out to the older adults. So the navigator would reach out to the consumer and with their permission does a screening, because remember, the older adults always has the right to say no, they don't want to participate. They would provide education on the risks of social isolation, and then they would make referrals based on the screening of the user's tool to the current consumer. And we determined that the resource network would be the neighborly platform. And we've discussed that we need to, as a community, make sure that everybody takes ownership of their own organization to keep that data as fresh for the entire community as well as this project. So you need to update what your programs and projects would be in there. If the older adult agrees to contact the referrals themselves, then they can contact the referrals. But this could also be a two-pronged approach, understanding that some older adults may be reluctant to do the referrals themselves. So the navigator could ask for assistance in reaching out to the referral. The navigator could do that. And then if you could see it. So the navigator would make the referral for if the older adult wants the help, they would make the referral for the client. They would need the verbal consent. And then depending on what the referral is, we all already recognize that there will be barriers to access. It could be transportation. It could be concerned that they don't want to be like the new kid in the healthy aging campus. So we have also thought about looking at recruiting other volunteers who would be willing to help accompany volunteer clients to the initial group meetings or activity, et cetera, just to help them have like a buddy program. So we would have a two-pronged volunteer outreach, one for the ones who want the highly trained piece and one who just wants to be the friend to the older adult to accompany them. It was determined that the navigator should reach back to the consumer in 1 week to update them on the status of the referral and to assess any barriers, as we've said, to accessing services or helping them overcome them. And based on the call, we keep the case open with an agreed upon time to reconnect with the older adult. And then to make sure we built in the data, we would also have to rescreen in 6 months, and if necessary, re-engage, because we need to keep the data on those who don't want to engage, and then the ones who do want to engage, and where we go with that. There is a concern as we look at this that there could be some service gaps that we will have to address as a community, depending on what the older adult need is. And I think that's it for me, and I'm going to send it back to Gary.
Thank you, Margaret. As we mentioned earlier, the public awareness campaign, and again, I would strongly suggest that you take a look at the report. There's much more detail than we can go over in the 5 minutes. The challenge that we have for the public education group, as Dr. K mentioned, is bringing a relatively unknown or relatively unseen, if you would say, problem and bring it to the forefront of the community. We were likening it to a corporation who is bringing a brand new product to the market and trying to get that word out to the community. And somewhere along the way, somebody mentioned it's like lighting a candle and putting it under a bushel basket. So we have to take the bushel basket off and make sure that it is seen and understood by the community. The overall goals of the Public Awareness Committee was basically to inform, direct, and connect. And you will see that listed in that slide. It's to inform residents of the community of the problem. It's to provide a path to direct isolated seniors, their families, their caregivers, to information and services to assist them. And finally, to connect the isolated senior to the programs that are out there and available to them and their families. Next slide. Just a real quick run through. The committee conducted 4 focus groups, which were done on July 20th and 21st with a number of seniors to determine their social media and their media habits of older adults. This was an incredibly interesting process. The seniors were very vocal, very much involved in what we were trying to accomplish. Now, obviously, the situation that we ran into is those older adults who joined the focus group themselves would not be considered isolated. They were individuals that were recruited through Area Agency on Aging, actually through 211 and the Farmers Market Voucher Program. Once they called to get their farmers market voucher, if they were in a certain zip code, we asked them to participate in this session. But we were able to glean a great deal of information from this group. As an aside, the most spirited discussion, I must say, was when we asked this group what they would like to be referred to as. Are you a senior citizen? Are you an older adult? Are you a mature individual? And basically, it came down to a little bit of a surprise of our group that they did like to be referred to as older adults and senior citizens. And the reason they said senior citizens is because it's attached to the senior citizen discount that they get. There was a group that really was interested in being called mature adults, until one woman said the word mature sounds like a peach that has gone bad. So she doesn't want to be called mature. So that was a pretty spirited group. And through that, we came up with a list of I guess you can say monikers or referrals that we can refer to these individuals as. We had a number of Zoom meetings with collaborative partners, and we had our secondary research, which is listed in the plan. So there's a great deal of work in pulling this together by the group. So if we can go on to the next slide, Christine. What this resulted in is developing the target audience, which included the informal caregivers. Informal caregivers would be basically neighbors, some family members, individuals like that. Formal caregivers, we're looking at physicians, other family members, the older adult isolated, and the general community. One of the things that came out, especially during the focus groups, is the importance of neighbors. That the groups across the board suggested that one of the things we look at is trying to establish like a neighborhood watch group, where one neighbor could knock on the door of the other neighbor to make sure that they are okay. Across the board, this group said that they trusted their neighbors as a whole, rather than someone coming into their home that they didn't know. The other thing was the enlistment of a respected spokesperson or a local champion, and specifically not a politician, not necessarily a clergyman or clergy person. It's an individual from the community, and there were a list of those that had come out of that session. We're looking at an extensive use of media as determined by the focus group research. It's interesting that we've done a really good job over the years in telling our older adult population not to answer their phone from individuals whom they don't know. That's a great thing. On the other side of that coin, it poses a problem for all of us because they will, if it's a phone call, they're not going to answer it. However, across the board, direct mail seemed to be a big piece that older adults like their mail. They like to open their mail. They like to read their mail. So that's a key piece. Another piece is the social media aspect of it. I think all but one in that group were active on Facebook. They all had Facebook pages. It's a way to connect to their family and friends and whatnot. So in addition to using selected electronic media and print media, Facebook would be a big piece of this. And the other piece was branding. Coming up with an easily identified, remembered, and consistent logo, coming up with a tagline similar to, I think it's FACE that the stroke group is using right now, the medical profession is being used. Something that the senior can identify with. Next slide. Another issue that was discussed, it should say reframing aging training. In addition to reaching out to the general community, it was felt that we need to reach out to the medical community, healthcare professionals such as home health, individuals that are running organizations like Meals on Wheels, ministerium, providing the ministerium with talking points for possibly sermons, or bullets in a bulletin talking about the whole idea of social isolation. So we would put together a training session in that vein. As far as medical professionals are concerned, we looked at the possibility of bringing in someone like a Dr. K, who would provide a seminar to physicians and nurses, possibly providing CEU credits to go along with that. One of the points that was discussed in great detail was a single point of contact. Whoever is going to be the champion or the leader of this program moving forward, we felt that it would be easier for a senior in particular and their family members to remember one single point of contact, an easily remembered phone number, and we were proposing 211. Although 211, when we asked our focus group, do they know what 211 does? No one really knew what they did, but they all heard of 211. And the way they heard of 211 is because that's where they got their farmers market vouchers from, and that's also where they got their taxes done. So 211 was readily acceptable as a single point of contact. The challenge would be that we would, our marketing campaign would, for the public, would surround around the 211 contact number. Older adult continuing involvement. Through the focus groups, we were able to develop a group of individuals who would be more than willing to serve as an advisory committee moving forward, who would help us to evaluate the program, not only our marketing program, but the program as a whole, to show what services were working, what services weren't working. We would hope to gather this group together at least twice a year as we review the project moving forward. Next slide. The collaborative as a whole decided, rather than running into or broad basing the program from the beginning, that we would conduct a pilot program, which would be a little bit more concise, using specific organizations to bring in seniors to participate in the program. From a marketing perspective, we would evaluate the pilot program and the marketing for the pilot program using the number of connections that are coming through 211, using the use and frequency of the Neighborly platform, which is being used for the connection with the navigators, and feedback from both organizations. Okay, that's Christine telling me I'm talking too long. You can go forward, Christine. So that's basically a rundown of the public awareness plan. Again, I would encourage you to read the entire plan. What we'd like to do now is open it up for any questions or feedback from the group. This document by no means is set in stone. This plan is very fluid. As we move forward, we hope to, tweak the plan here and there to make it a little more acceptable to the community and to those who are in need. So again, if there's any questions or, what do you like about the system, the strengths, the weaknesses, and how can this plan intersect with your own organization or your own work?
So everyone can type their feedback in the chat box or in the Q&A. We did get one question: where can we get the full report? We'll be following up via email with everyone who registered with more information there. Someone also asked, what is the age range for this initiative? Peg or Gary, do you want to take that?
I would say it's from 60 and above. That would be my best guess on that at this point.
It's the only feedback we have at this time. I don't know if you guys want to wait for more or move on to next steps.
Well, it's a lot of information. We've given them all at one time. I think questions can develop as we go forward.
Right, as we move forward and as individuals have a chance to actually read the plan, please, we encourage you to, email either Peg or myself, or anyone actually who is on the collaborative with your questions and suggestions. The other thing that I would stress at this point as well, it's in the 2 years that we've been working on this, personally, I've been educated greatly on the problem of older adult isolation and have become much more aware of it. And I think one of the things that we all should be doing, if we all do have skin in the game, is educate ourselves, continue to educate ourselves on this problem and this situation. Keep your eyes open for those around you, your neighbors, your family and friends who may be in this situation. As Peg and Dr. K had said many, many times, it's very difficult for a senior to come forward and say, I'm isolated. And it's rare that they do that. It's up to us as a community to identify those individuals and to provide the services for them.
Yeah, Gary, you're so right in that. And I just want everyone to know the Moses Taylor Foundation is committed to this priority, the priority of reducing adult isolation, bringing the value and respect of these adults back into our community. And we are not going to step away from this in any way. The collaboration is extremely important, and you can see that that's the only way we will succeed. But we are behind this. It's a strategic focus for us, and I just want to thank everyone for that. And we need to kind of tag on to, you know, the small silver lining of the pandemic, that everyone now understands, or should have a better understanding of what it feels like to be isolated, not to have contact with others, just the difficulty of getting food into your house, you know, different things along that way. So we want to build on that momentum and not lose it. So I want to thank everyone that's involved in this.
Well, and Mary, if I can add, thank you for that, and thank you for your thank you for your support. It's safe to say that we wouldn't be here, we wouldn't be this far ahead if it wasn't for the foundation and the faith that the foundation has had in this initiative. Moving forward, and I could say Peg and I have kind of laughed and talked about this a little bit as we went. In my previous life, I've done a whole bunch of different strategic plans that have ended up in a nice blue binder on a shelf once they're completed. And I am convinced that this plan is not going to end up in a nice blue binder that's going to sit on a shelf, because of the enthusiasm that I've seen over the past 2 years of those participants and individuals who have been involved. So part of the work is, I guess, completed with the plan. The difficult work is before us, and it's the next steps. Where do we go from here? Obviously, whatever organization takes this on as a challenge, there will be, you know, funding challenges that will exist as we move forward. We have to develop our navigators. We have to fine tune the platform, I guess you would say, how individuals are getting into the system. We have to look at the gaps in you know, we're fortunate in this community to have many services that are helping seniors, but there are some gaps, and we have to take a strong look at those gaps and how we can fill those gaps. This isn't a program that you're going to flip a switch and it's going to start up tomorrow and be successful. It's long-term. It's a long-term commitment from the community and from the organizations involved. And I'll tell you from the part that the United Way played that we're committed to move this forward.
We pick up any questions, Christine, as we move forward or not? Or anybody has, maybe they're not questions, anybody have any thoughts they'd like to share with us?
Yeah, if I could just throw something out that and I think this is worth sharing. Phil Yevich is one of our, he has been with us from the beginning, and Phil is with the Scranton Ministerium. And last night, yesterday afternoon, when we were getting ready for today's presentation, Phil sent us an email, which I thought was very timely. Tonight begins the Jewish High Holy Day of Yom Kippur. And Phil notes that when observant Jews drive to hold themselves accountable for the way they live and the way they accept responsibility for the welfare of all. And he says, this is basically what we are trying to do with this initiative, take responsibility for meeting the needs of all members of our community. And I thought that was incredibly insightful. And it was a nice way wrap up of what we're trying to do here. So thank you, Phil, if you're on for that.
We do have a question. Does the plan currently have a proposed time frame to achieve specific results? Thanks.
Peg, do you want?
Well, we hope that it can be implemented starting in January, and that we would look like at a 2-year window of being able to look back and see where the success, the success or the lack of success would be. They're going to be rescreened in 6 months. And as we know, when you start any kind of a new program, it's going to take a little while to get people to participate. Our track record here is it's a little slow in the beginning, but then as you start programs and they become more well-known, more people participate in them. So that's why we went with a longer concept there.
Yeah, and if I could add, there was a great deal of discussion surrounding whether the program should start off full blown in the beginning or whether we do the pilot to test it out to see how it's working. And that also impacted the public awareness piece. The fear that we had is that if we're just doing a pilot and we spread out this big PR marketing campaign, that individuals might start calling and the services won't be up and running and they won't be available. We won't have our acts together. So I think the initiation of the pilot program is really going to tell us, be very telling to our work as we move forward.
We have a couple comments in the chat box. WVIA is very interested in partnering with us on this initiative. That's great to hear. Also, E. Casey from AARP Foundation is complimenting the work and inviting everyone to join their Commit to Connect Champions Network, where we can share our insight with the rest of the country, people who are working on this issue.
This is what Dr. K kept telling me. I thought it was just happening in NEPA. He telling me we have a broader platform.
Peg, you're exactly right. I have encouraged the group throughout to be prepared to share your experience, not just locally and not just regionally, but nationally. And it could even extend internationally. If you succeed in mobilizing this community of yours, there'll be a powerful story to tell and you need to share it.
Personally, I just want to thank everyone who really actually, the foundation gave us the parameters. I've been the person sending out all the emails and everybody had to listen and get all my emails and come to meetings and listen to me talk and ask for assistance. So I personally thank all of you who are really on here. We could not have done it without you. We really couldn't.
And I'm just going to add one last thing, and I don't want to embarrass anyone, but I just want to thank Christine, because Christine was a driving force in moving this forward, and it was probably one of the most active involvements that I've seen working with a funder. She really was a force behind this. So thank you, Christine, for all the work that you've done as well. Again, I'd like to just echo what Peg and Dr. K and Mary is all saying, that thank you so much for joining us. Please continue with us. Please continue as we move forward. This issue is too important to let it slide. We saw that over the past 18 months or so with COVID and the number of seniors who were isolated and desperately needed assistance. And I have to say, if I could just add, thanks in large part to this program. Once COVID hit, we had already established group of partners that we could pick up the phone and call and immediately work and move forward. And it was because of the partnership that started in collaboration because of this initiative. So that was an unexpected, I guess, silver lining in this cloud. So again, please, keep the lines of communication open. Tell us what we're doing right and what we're doing wrong, and please join us. I mean, we can use your help.
Mary, Christine?
No, again, thank you everyone for your involvement. We're going to keep this moving. And I just want to echo what Gary has says, I started my life with the foundation as a board member in the very beginning. And as a board member, you're involved in different things, but not until I assumed the role of interim CEO did I have any inkling of the amount of work that the staff does here at the foundation and what Christine has done with this and her other projects. It's really remarkable. And I just want to thank her and thank everyone here. And we will keep this going. Okay.
Okay, thanks, guys.
Okay.
Thank you all.
Okay, thanks.
Have a
good
great day
everyone.
and we'll see you all soon.
Okay, bye.